When we have a patient undergoing phototherapy, we have to bring them into the private phototherapy room. We have a separate room, of course, because they have to get undressed in order for the ultraviolet light to actually get exposed on their skin. In my present office, the space is quite limited, so we have a small machine here which rests against the wall. The patient comes into this room and is asked to undress to get to the areas of the body that we need to treat. We always have to protect the eyes. Ultraviolet light, as you know, is dangerous for the eyes, so we have these special glasses that filter out 100% of the ultraviolet rays. Once they're on, we'd also ask patients to put a number 15 sunscreen lotion on them to protect themselves in areas where they don't need the ultraviolet light to be exposed on their skin. Once they're in here, they're set. The nurse comes in and actually picks the amount of time that the ultraviolet light will be on their skin, starting at a small amount, and each time they come in, it gets more and more. And the machine is turned on with a switch back here. And we're actually producing actual ultraviolet rays here. If I were to stay in here very long, not being used to this, I might get a sunburn. So we're going to keep that off right now. There are many types of ultraviolet light machines, and in the current situation I have this one and one designed to treat hands and feet. So it's a much smaller unit where a patient can actually just sit on a chair and rest their feet on it or their hands on it. But in the new building we're building across the street for the Skin and Allergy Medical Group, we're going to have a room about 4 times this size with the latest computerized device to treat psoriasis and other rare skin diseases. This will use both ultraviolet A and ultraviolet B, allowing us to use not only ultraviolet that burns, but ultraviolet that doesn't, and another technique called PUVA, P-U-V-A, which is used to treat psoriasis. This machine will be computerized and allow us to actually pick the amount of time they're being treated using different computerized formulas, making it a lot less difficult to ever make mistakes in seeing that the amount of time is right for each person. Phototherapy for treating psoriasis and other rare skin diseases. It's the work of a dermatologist. If you have questions about whether phototherapy might help your skin problems, then you should discuss them with your dermatologist. Well, that's our program for tonight. I'd like to invite you to write to me at my dermatology and allergy office in Yuba City with your suggestions for areas and people that you'd like to see here on the Medical Explorer program. As you know, the Medical Explorer is a public service program, and I really do want to hear from you with your comments and suggestions. Please write to me at the Skin and Allergy Medical Group at 367 Del Norte Avenue, Suite 4, 95991. In my next program, the Medical Explorer will take you behind the scenes of more interesting frontiers of medical care practices right here in Yuba City and Marysville. Till next time, I'm Dr. Robert Peppercorn, your Medical Explorer. Thank you for joining us tonight, and have a good evening.